Like, for example, so I talked about this train disaster in East Palestine, and the railroad companies hate me because I kind of went on a crusade against them afterwards. And what I realized is, think of all the costs of that disaster. Think of the healthcare costs, the welfare costs from people who lost their jobs, the declining home values in that community, just all of the costs absorbed by that community. And the railroads are paying slap-on-the-hand fines. And it sort of occurred to me that the reason they're not more serious about these train disasters is because they're privatizing the rewards. But when a major train disaster happens, who picks up the tab? It's the local residents and it's the American taxpayer. And that's something that fundamentally has to change.
Yeah, that has to change. And when you're talking about the cost from a place like East Palestine, how much can they clean that up? Like, how long does that stay toxic?
Man,
because it was millions of gallons, right? Wasn't it some? What was the number of gallons?
I don't know
of
the
stuff?
number of gallons, but it was a lot. And I hate to say the answer to your question, how much can they clean up? The answer is I don't know. And this is one of my biggest frustrations, probably my single biggest frustration over my time in the Senate, is when this happened, a bunch of the residents came to me. It's actually very sweet and even kind of patriotic, but certainly self-sacrificing, where they said, look, no one knows what the effect of this shit is going to be 15 years down the road, right? Because we weren't worried about, okay, a guy drinks the water in East Palestine and drops dead. The water levels did not have toxins at that level. But the question was, what happens when you're imbibing this stuff, breathing it in, drinking it at trace levels for 10, 15 years? Like, do you have weird diseases down the road? Hopefully not, right? I pray every day that hopefully not. But you can only study that in the moment.
Right.
And so we actually, working with a public health epidemiologist in North Carolina and some in Ohio, we actually came up with a plan. Like, here's what you would need to do. You'd collect samples in the first 6 months to a year after the disaster. And I'm talking about like fingernail clippings, things like that. You'd establish a baseline of toxins in people's blood. And then 5 years later, 10 years later, you try to figure out what the toxins were in people's blood 5 years, 10 years down the road. And then you'd ask yourself, what weird diseases, if any, are people starting to develop after 5, 10, 15 years, right?